Still on hepatitis and the rising cases in Nigeria. If you're just joining us, this is still New Day, and you're welcome as we take a deep dive into the relationship between hepatitis, or what you may call chronic hepatitis, and cardiology. And joining us right now on Zoom is a resident cardiologist all the way from University of Jos Teaching Hospital in the person of Dr. Caroline Oritogun. Doctor, good morning and thank you for joining us.
Good morning.
Good morning. How is Jos this morning?
Yeah, Jos is quite cold and drizzling.
Usually.
Yeah.
Thank you. Right, you are a cardiologist.
Yeah.
Yes. Tell us, what exactly is the relationship between hepatitis and your area of expertise, cardiology?
Okay. Thank you very much for this question. First of all, hepatitis, like we all know, means inflammation of the liver. Inflammation is the body's normal response to any injury or any form of infection. So in this case, hepatitis, meaning the liver, if there's anything causing injury to the liver, there's an ongoing inflammation that will occur, which is normal response, like I mentioned earlier. And all of this can affect the function of the liver. There are quite a number of things that can cause this inflammation. Like we all know, the common infections, the viral hepatitis, A, B, C, D, E, and then other things like toxins, alcohol, drugs, chemicals, and other foodstuffs may be harmful to the liver too, can cause inflammation. Talking from the point of a cardiologist, cardiology, which we all know, is a study of the heart. So the heart and the circulatory system. The circulatory system comprises of the heart and the blood vessels. These vessels are like channels that carry blood to other organs in the body. Talking about the heart as a pump, it pumps blood to every organ in the body, and this blood is carried from the heart to other organs by these blood vessels. So anything that will affect the pumping of blood to other organs like the liver can cause injury to those organs. The problem could be directly from the heart when the pump is failing, or the vessels that carry this blood. If there's anything occluding these vessels and not allowing this blood to flow to get to these organs can get injured. In hepatitis, when there's ongoing inflammation, the body is expected to, inflammation is a form of a body's normal response to cause a repair to any injury that is ongoing. And in the event that the body is unable to succeed in doing that, the damage progresses onto death of cells. So when the heart does not pump sufficient blood, or the blood is not getting to the liver, the cells there begin to die. Like we all know, every organ needs blood and nutrients to survive. So once that is not available, organs begin to malfunction, or the cells begin to die. And in the case of hepatitis, once there's cell death, there's what we call cirrhosis, because the body attempts to repair the damage that has occurred. And in an attempt to repair the damage, cirrhosis occurs. There are bumps in the liver. Are you with me so far?
Thank you very much, Dr. Caroline. I would like to ask a very straightforward question. I know you've had real-time experience with a patient. Can you tell us or describe how the situation was for you? What was your experience with a patient that had hepatitis?
Okay. Actually, like you rightly mentioned, we commonly see patients with hepatitis, And most often they come to us late. When there are already complications occurring, there's damage that's occurred from the chronic injury to the liver. They come down with symptoms like yellowish discoloration of the eyes, which we term jaundice, and body swelling. You see, the tummy gets swollen because over time the liver is not able to perform its function. There's like production of proteins, and the proteins are needed to regulate this fluid, cause a balance in the body. And in the event that the liver is not producing these proteins, fluid begin to accumulate in places whereby they are not meant to. Ideally, fluid should be in the vessels, not in the tissues. But in this instance, fluid begins to accumulate. That's why they have this bloated tummy. The tummy becomes distended, and over time, it extends to involve the limbs and other parts of the body. And they also have this cachectic look on the face. That's the face looks shrunken, and then they become very hyperpigmented. That's the skin color becomes very dark because there's a hormone that is produced that causes this darkening as a result of this chronic inflammation that is ongoing from the liver. Just to add a little, most of the symptoms seen in hepatitis can also be mistaken for symptoms that are seen in patients with heart problems. So sometimes patients come to us with symptoms that appear as if it's a heart problem, because this swelling can also occur in patients with what we term heart failure. So they can have body swelling and all of that, but they do, and occasionally they can also have yellowish change in the color of the eyes. Okay, so sometimes it's in the event of investigation, examination, investigations that you discover that actually what this patient has is hepatitis. And the experience is not quite good because most people come when it's already very late, when there's little or nothing one can do. And like we all know, hepatitis leads to cirrhosis, and then over time, cirrhosis can lead to cancer and then eventually death. So these are the common experiences we have, which are not pleasant. And I'm sure that's why the World Health Organization has slated this date, 28th of July, to commemorate World Hepatitis Day to prevent this from happening. Okay, the theme for this year is it's time for action now. So we need to act now. If we don't act now, the future is threatened. Yeah, thank you.
All right. Dr. Oritogun, as a cardiologist and a clinician, if a patient presents in your clinic with yellowing of eyes, I heard you just mention that is one of the clinical symptoms, how would you, as a clinician, assuming you are operating in a remote area where you don't really have access to, all these other tests, how would you, seeing the clinical symptoms, say, okay, this is hepatitis based off of an underlying heart issue, as compared to maybe viral hepatitis? How can you decipher, hepatitis that's caused by, complications of the heart from that is caused by probably a viral hepatitis like hepatitis B or C?
Okay, first of all, as a clinician, assuming I'm working in a remote area, first of all, I'll have to take history. History means asking a patient basic questions, because a patient that has a background heart problem would suggest more of a heart disease. However, it's not like both cannot coexist. Okay, so symptoms of heart problem like what we call autopnea, paroxysmal nocturnal dyspnea, like patients not being able to lie flat. These are symptoms related to heart failure. So if I ask this patient these questions and they are not there, I'll tilt more to liver disease. And in most times, the yellowish change in this sclera of the eyes in patients with heart problem is not as deep as that seen in those with viral hepatitis. So even though there are times that you can also get patients with heart problems having a deep tinge, but it's very rare. Uh, that is it. And then also, I was apart from symptoms after I'll also examine these patients. There are some examination findings I'll be looking out for. Stigmata, something we call peripheral stigmata of chronic liver disease, is likely to be present in a patient with chronic viral hepatitis, which is seen as flopping of the hair, the parotid fullness, that's the side of the face looks full, especially those that have alcoholic liver disease. Then you have scantiness of the hair in the axilla. Then they might have, for men, they might have gynecomastia. That's ideally a man should not have an enlarged breast. So when you're seeing an enlarged breast in a man, you should suspect that. And for a woman, the breast will atrophy, meaning they will lose their luster. They will no longer be firm. So that, and then other things. Then the ascites could also be seen in both, but when you examine the abdomen, you might see some prominent veins, and those veins suggest more of a liver problem.
Okay, thank you very much, Doctor. I would like to ask, because we're trying to educate people and keep them informed about how hepatitis can affect not just their liver, but also parts of their body that are very vital for their living. So how common is patients with hepatitis to develop heart problem?
Okay, you know that the heart and the liver, they work hand in hand. So the heart supplies the liver with blood, and then blood also from other parts of the body come in, pass through the liver, and then get back to the heart. Okay, so if there's any injury to the liver loses its architecture. So the architecture of the liver becomes rough. That's why we refer to it as cirrhosis. It's rough, it's no longer smooth. And because of that loss of architecture, the vessels, that's the channels through which blood flows, are now also distorted. And because of that distortion, blood flow is also hampered. And when blood flow is hampered, the return of blood back to the heart is also affected. So, but mostly the problem is basically if there's a heart problem affecting the liver. But the liver, on few occasions could cause a heart problem because of continuous accumulation of fluid that could also occur in the chest, and fluid from the chest could also affect the heart, and then accumulation of fluid also in the covering of the heart, which also affects the heart from pumping blood, because once there's fluid accumulating around the heart, it will not have enough space to pump blood to other parts of the body, and then there wouldn't be enough supply, and vice versa. So it's just like a circle, like keep going up and down from the heart, liver, back to the heart, and all of that. So
all right, doctor, you have extensively talked about heart issues as probably having hepatitis or issues of the liver as comorbidity, right? You mentioned the heart directly impacting the liver, but could we do it the other way around, like the vicious cycle, turning it the other way around? Assuming there's a patient that has gone through some kind of major operation and had part of the liver removed. Now, with that in place, would it have any direct pressure on the heart? You know, having part of the liver removed, does it like have a direct or indirect pressure on the heart, probably resulting to heart issue?
Okay, when you say part of the heart removed, do you mean
I mean part of the liver removed, doctor.
Part of the liver removed, sorry.
Yes.
When you say part of the liver removed, do you mean a resection, like for a transplant or something? Because if the liver is able to regenerate itself actually.
Okay.
So Like patients that have a liver damage, maybe have a cancer that has not really spread throughout the
Yes.
liver, is to a part of liver, that part can be removed, can be resected, and the remaining part of the liver can regenerate itself, that
In
can
every
regrow.
case, doctor, does it regenerate in every case? And if it doesn't,
Yes,
does it have any direct negative impact on the heart?
not really. The liver is one of the organs that is known for regeneration. It's very good at doing that. That's why one of the good treatment or a best treatment for patients who have limited liver problem or liver cancer limited to a part of the liver can benefit from it, because once that part is removed, the remaining part of the liver can regenerate itself and function normally without issues.
Okay, so you're saying there's no predisposition to heart infection in any event of a liver, excision. The heart is okay.
No, no, the heart is okay. Yeah,
All right.
except if there's already a damage and there's no resection done, and the pressure is built up there in the liver, and the vessels are not able to flow like expected, as expected. That's when the problem comes in. Yeah.
Okay, doctor, thank you very much. I know you were the first person who ever asked me, have you done your hepatitis test? And I was like, oh, I don't know what that is. So my question is, how has publicity been concerning this? How have we been able to educate people to do more tests and to get tested or even get vaccinated concerning hepatitis?
Um, like, in remote places, it's actually very difficult. A lot of people are not even aware of the dangers of this virus, not to talk of having themselves tested. So if we can do more of publicity, for most of the people in the village do not have this media, the social media, they don't have access to all of this. Some people have to go to the extent of doing some medical outreaches. We do that a lot in this part of the world. We go to villages, educated people on hepatitis, do free screening and testing, especially on days like this. And then in the hospital, we once the patient comes in, we ensure they get screened. There's no patient that comes into the hospital and leaves without being screened for hepatitis, because it's a war actually. Hepatitis is actually consuming a whole lot of lives. And it's just sad that most people are not aware. And publicizing this, either pamphlets or outreaches for people who are financially buoyant, they can sponsor all of this, and it will go a long way in saving lives. And if these people get tested and they are positive, some of them do not even know that there are treatments for this hepatitis. Like hepatitis C can be treated and cured. However, hepatitis B, on the other hand, does not have a cure but can be managed, in that it will not cause a chronic damage to the liver. The person can live with it without having any issues if the patient is on certain medications. So some do not have access to treatment, because it's like basically in teaching hospitals that you get treatments. This treatment is not found in other hospitals. I've noticed that general hospitals, all these PhDs do not have access to these medications. And some of them are not even aware that this virus can be treated, or the dangers of these viruses. So I think more work needs to be done on awareness.
Thank you very much, Dr. Caroline Oritogun. This is where we're going to be saying thank you very much for your input and your insight on this topic. Thank you very much, Ma.
All right, thank you.
Yes. We've been speaking to Dr. Caroline. She is a senior resident cardiologist, Just University Teaching Hospital, and she has been giving us insight on cases of hepatitis in Nigeria, things to know, how it affects the heart, and how it is a very, very important that we get vaccinated, get tested, and get to know your status, of course, if you are infected. We're going to be moving to our next conversation and our next discussion, but you do not want to go anywhere. We'll see you after the break.